Hi friends, today we are going to talk about how to take history, especially in the medicine subject. People are really facing some difficulties to take histories because the history is a very important thing that we can diagnose or you can come to a differential diagnosis to a patient. Okay, so let's go. Before taking history, the first thing is we have to introduce ourselves to the patients and we have to ask permission or consent to ask some questions. So after taking history permissions, we can go forward into the parts of the history or components of the history. There are totally 9 points we can see in the components of the history. The first one is the personal detail. Personal detail is very important because that is giving more information about the patient, and we can approach a patient very easily, and we can manage the patients. So that personal detail that gives a lot of information that helps to manage the patient. Second one is chief complaint of the patient, but here the main thing is we have to ask about the duration in any kind of chip complaint. That is very important because that will help in coming to a diagnosis or differential diagnosis. The third one is history of presenting complaint. This is the very important part of the history that we can come to a 90 or 80 percentage of diagnosis or differential diagnosis. This history of presenting complaint have 4 subgroups. That's very important. We will discuss about this later. And the fourth one is a past medical history. Fifth one is past surgical history. These two are very important to come to a diagnosis or differential diagnosis. The sixth one is drug history. The seventh one is allergic history. Eighth one is a family history. And ninth one is a social history. This is also an important part of this history because it shows how we are going to manage a patient. Uh, that's all. Now we go into the first components of history, that is here see there's a 9 points totally because I have put this to recall when you think about the component of the history. If you forget something about some 1 point or among these all, you must remember there's a 9 points. So when you miss something when you remember when you after taking history, if you history components is 7 or 6, you must think about the missing points because totally there's a 9 points. Okay, let's go to a personal detail of the patient. Okay, it's very important to know about the patient and to go forward about the management plan. So what are the parts of this personal details? First, name. It's for an identification of the patient. And the age. It is very important for approach and the management of the patients because if we are going to do a surgery, assessing the fitness for the surgery, we can see the age also because age may be young patients are mainly fit for the surgeries, and all patients are really having some problems. So not only in the surgery medicine also, the approach is very important towards the age. Sex are important for approach and the management because if we take a female, they have their own privacy. So by respecting their privacy, we are going to manage. Religion are very important for the approach and management and also for their privacy because different religions have their own cultures. So we have to respect those things also. And the address important for the follow-up as well as, and the occupation important for approach and their management. Marital status also very important. And finally, the date of admission and the date of examination. So here also again 9 points. So if after the collecting the personal detail of the patient, if you forget, suppose if your total point is 6 7, you must remember there's a 9 points. So what are the points are missing here? So this I have included these 9 points that star mark because if you forget So if you forget anything about this, you can remember the missing point. Next, we are going into the chief complaint. Here, that when we think about the chief complaint, we have to ask some questions. What are those? Why did you come to hospital? That's the first question. And the second question is the duration of the problem that the patient have. Okay, so we have to ask when we come to the chief complaint, we have to ask why did you come to the hospital and how long you have this problem. And also, suppose if we say fever, we have to ask the association, some associated symptoms, because fever, if you say fever, to come to some diagnosis where we have to ask this is associated with any cough or any sputum productions or any joint pains and all. So we have to ask some these two main questions and also the associated symptoms. The third one is the main thing, the history of presenting complaint. As I have told you, it have four subcomponents. If we use these four subcomponents very carefully, we can come to 80 to 90% of diagnosis or differential diagnosis. So what are the four components? First one is a symptom analysis. If a patient's come with a fever, or if a patient's come with a fever, we have to analyze the fever. Example, what is the temperature of the fever, and what is the temperature of the fever? How long it is there? How many days do you have the fever? And we can ask whether is it subsided with the paracetamol. After taking paracetamol, how long you are fever free, and was there any associated symptom such as a cough, a joint pain, like that, and evening rise of temperature, then evening rise of temperature, and loss of weight, loss of appetite. These are the things we are going to analyze regarding the fever. So everything, if we take a back pain, we have to analyze like this. If we take a chest pain, we have to analyze like this. If we take a cough, we can analyze like this. So we have to know some common disease in our part of the country. So by remembering that, we have to ask some questions to analyze the symptoms. The second one is etiology. So there are common, suppose if we take a cough, etiology, if we think in our part of the world, it may be tuberculosis, it may be pneumonia, it may be a lung fibrosis, it may be any pleural effusion, it may be even the heart failure because it can cause nocturnal cough. So like this, like that, we have to think about a common problem in our part of our country. Just give priority to that. Third one is complication. After symptom analysis and etiology, at least we might have come to 80 to 90% of the diagnosis or differential diagnosis. Then we can ask some complication regarding those diseases. Then the final one is investigation and treatment up to now. These are the four components we are considered in the history of presenting complaint. If we use these four components of the history of presenting complaint carefully, we can come to a diagnosis, differential diagnosis, 80 to 90%. That's enough. Okay, now just this shall we analyze this all four to a chest pain, because when the patients come, he won't complain, doctor, I have a ischemic heart disease, or I have angina, or I have a pericarditis. The common people will complain, doctor, I have a chest pain. Oh, doctor, I have a fever. Suppose if we take fever, the patient won't complain, doctor, I have a tuberculosis, I have a pneumonia, like that. These are the common complaints: fever, chest pain, back pain, joint pain. So now we shall be discuss about the chest pain. Okay. Okay. Let's see these four subcomponents when the patients come to you with the chest pain. Okay. Come on. Chest pain. Chest pain. This is a chief complaint. Now we are going to analyze the history of presenting complaint. First part is symptom analysis. As this is a pain, there is a synonym we call Socrates. This is a synonym we use to analyze the pain. So what does it stands for? Socrates S for site of the pain, or onset of the pain, when it started. See, character of pain. There are different characters of pain. It may be dull aching pain. It may be a constricting type of pain. It may be a excusing type of pain. So these are the character of the pain and radiation of pain. It may pain if you see in the chest, it may radiate to the jaw and the left hand, upper arm and arm, or it may radiate to a scapular region, backside. And then associated symptom, it may associated with nausea, vomiting, and the time or duration, how long the pain you have, and E for exacerbating factors, when he exposes you to cold or when you do any hard works, and the relieving factor, we have to ask when do you feel for relieving, when do you feel the pain is low, or what, like that, then as for severity. So here a differential diagnosis in case of chest pain, it may be due to acute coronary syndrome or aortic dissection or pericarditis or pulmonary embolism or pleural effusion or epigastric pain. So from the analysis of the pain, at least we can come to a 50% of diagnosis. So now we see, okay, what will be the etiology? The common etiology here, same as the differential diagnosis, but we saw in the symptom analysis, maybe acute coronary syndrome, or aortic dissection, or pericarditis, or pulmonary embolism, or pleural effusion, or epigastric pain, etc. Then complication. Suppose if we take this chest pain as is coronary acute coronary syndrome or ischemic heart disease, what may be the complications? It may cause arrhythmia, heart failure, or secondary renal failure, respiratory failure, and also it may affect a daily activity. That is also a complications. The final one, investigation and treatment up to now, this also can help you to come to a diagnosis, a differential diagnosis. Suppose if we see avatar, if we ask the patient investigations, if patient may say, doctor, previously when I was admitted in hospital, they did some ECG and echo and they have told I have some problems in my heart. He may say, so that word even confirm your differential diagnosis that he is having a problem in the heart. So that kind of questions, it will help you to come to a diagnosis. So we can ask basic investigations such as full blood count, fasting blood sugar, serum electrolytes, and ECG, chest X-ray, 2D echo, cardio biomarkers, lung function tests. These are the basic investigation you can ask. Or even patients may say they took X-ray and also, so that will confirm your diagnosis and differential diagnosis. And also treatment, very important. We can ask any drugs over 1 hour with monitoring. That means streptokinase. It may be given in case of heart attack. So that will suggest you, and also PCI in case of heart attack, IV antibiotic, and etc. Okay. So we have to ask these all as a question. For example, see the complications and take heart failure. Ask, do you have orthopnea or difficulty in walking, exertional dyspnea, nocturnal cough, loss of appetite? Ask questions like these to all complication and exclude the disease. The next one is past medical history. Here we have to ask some diseases such as diabetic mellitus, hypertension, and ischemic heart disease, epilepsy, bronchial asthma. These are the common diseases the patient might had experience. So, but if the patient is having a diabetic mellitus or hypertension, we have to ask more detail about those diseases because they are so common. So, diabetic mellitus, if we see, ask do you have, if no, ask when did you check your last sugar level. If the patient say yes, I have a diabetic mellitus, then ask about the duration and the treatment, what he is taking. He may be taking a drug such as metformin, or he may be taking an insulin. So ask what do you use. And if he is taking a metformin kind of drugs, we have to assess the patient for any organ failure because this metformin is contraindicated in case of organ failure. So we have to change the drugs. And if he is taking insulin, we have to ask what insulin he is using and what is he using, whether it is insulin pen or is he using any injection. and where he is storing the insulin. Usually we store insulin in the middle compartment of the fridge, and we have to ask about the knowledge in how to use the insulin and all. And very important, we have to ask about the micro and the macrovascular complications of dermatitis. You can assess his vision and ask, did you check your eye? When did you check last time? If he is not checking, we have to advise the patient to uh, check his eye, and also we have to assess the side effect of the drugs. So in and out, we have to ask in case of diabetic mellitus. If a patient is having hypertension, ask do you have, if no, ask when did you check your last BP level. If we say yes, I have a hypertension, ask about the last BP level and the control. And also we have to ask about his lifestyle, and it's very important. And we have to ask about the drug what he is using and the outcome of the disease after using the drug. And also we have to assess the side effect of the drugs, and the main thing is here we have to assess the patient for the end organ damage. Okay, that is very important. And we also have to ask in and out about the hypertension. The other disease such as ischemic heart disease, bronchial asthma, and epilepsy, same, we can ask the same questions, such as we have to ask about the duration, treatment, and outcome of the disease after treatment, and the side effects of the drugs. Okay, and here in the past medical history, very important thing to ask is any hospital admission in the past. That will help you more and more to come to diagnosis or differential diagnosis. The next one is past surgical history. Here we have to ask about any past surgeries done. If yes, we have to ask what anesthesia they have used, whether general anesthesia or spinal anesthesia or a lumbar anesthesia, like that we have to ask. And also we have to ask delayed recovery after general anesthesia. Have we experienced anything like that? Or post-operative ICU admission or any complications? And also the last thing we can ask, we have the old diagnosis card. The next one is drug history. We have to ask what are the drugs are you taking, and ask for the prescription if he can. If the patients have the prescription, he may give. If he is using drugs, ask the name of the drugs and the dose and how long he is using the drugs, and per day how many times he is using the drugs. When we say the name of the drugs, we can assess, or we have to assess the side effect of the drugs by asking some questions. And also we can ask, are you using aspirin, clopidogrel, warfarin, like that. So one is allergic history. We have to ask about, do you have any allergic to food? If there is, if the answer is yes, we have to ask what are the foods, name the foods, and allergic to any drugs, and allergic to plaster. The eighth one is the family history. Here we have to ask this is very important because it will help you in the management of the patient, such as family history of suspected disease such as diabetic mellitus, hypertension, ischemic heart disease, bronchial asthma, epilepsy. We have to ask if the patient, if the patient if they having this kind of disease, we have to ask, or we have to suspect the same disease in their family members. Now, how many members in family? Because in case of TB and also some contact disease, that will be helpful. And how many rooms you have, inside toilet or outside toilets, because it depends, or it related with the hygienes. And one toilet for how many persons, water facilities, number of children and their ages is very important. Next one is social history. That's very important in and the aspect of the management of the patient, because that is also very important in management of the patient and also follow-up. First, marital status we can ask, because if a patient is affected, suppose if a woman is affected, it's very difficult to maintain the family and to take care of their children. Same as the man, he has to earn money and give money to the family, so then only they can survive. So marital status important. Then the children, and whether the patient is taking alcohol or smoking. Ask about detailed dietary history. In case of several diseases, it will be more helpful. Occupations of both husband and the wife. monthly income is very important in the management. Then closest hospital, because in case of any emergency, we have to ask what is the closest hospital he is having, because it's very important to admit the patient as soon as possible. Then distance to the hospital, that is also same as like that, because sometimes when we do a follow-up, we have to consider about the distance. So that if the patient is far away like 50-60 kilometer, a little bit difficult to come to follow-up, so uh, we can advise the patient to go to a nearest hospital with all his medical details. And we have a vehicle at home, that is also helpful in the follow-up. In relatives living close by, so in case of any emergency, they can help you. And knowledge about the condition, that is very important, because the patient should know what he is having, a disease is having, and how to manage, and what are the drugs, and how long, how many times per day he has to take, and the outcome of the disease, everything he should know. That is a duty of a doctor to explain about the disease having. So here I have included a point a detail, that means 11 points, that also will help you to remember at the exam. Thank you. We'll see you in the next lecture. If you need any lectures regarding any topic regarding a history taking, just comment below. Thank you.
You will see you in the next lecture. If you need any lectures regarding any topic regarding a history taking, just comment below. Thank you.